Done. Okay, Colleen, go ahead.
So welcome everyone. Thank you so much for coming. It's a pleasure to welcome you all to our first ever Alberta-wide nursing rounds. I'm Colleen Norris and I'm the Associate Dean of Research at the Faculty of Nursing at the University of Alberta, and I'm thrilled to help launch this province-wide initiative that brings nursing research and frontline practice to closer dialogue. Alberta-wide nursing rounds are building on the foundation of our long-standing citywide nursing rounds, an initiative that connected nurses, students, educators, and researchers here in Edmonton for many years. But now we're expanding our reach. By going province-wide, we're trying to create space for nurses from all corners of Alberta, urban, rural, and remote, to share knowledge, raise questions, and build community. This is about amplifying the voices of nurses and ensuring research and practice truly inform one another. These rounds are about more than just sharing findings. They're about tackling the real-world issues you face in clinical practice and celebrating the impact of nursing scholarship. Thank you so much to our presenters today. A special thank you to the Faculty of Nursing team, especially Lindsay Comer and Heather and Usha, for coordinating today's sessions. With that, I'm going to turn it over to Lindsay, who's going to be our moderator for the evening. Thank you so much for coming, and please enjoy the session.
Great. Thanks so much, Colleen. And thank you for that warm welcome and for your leadership in shaping Alberta Red Nursing Rounds into what it is today. I feel a little sad that we're not calling it Citywide Nursing Rounds, but it feels good to open it up to everybody. So before we begin our session, I'd like to take a moment for a land acknowledgement. The Faculty of Nursing at the University of Alberta is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, and Inuit, and many others whose histories, languages, and cultures continue to enrich our vibrant community. We recognize and honor the histories, languages, and cultures of the first peoples of this land, and we commit to working together toward reconciliation and equitable health outcomes for Indigenous communities. Just a few quick housekeeping items before we begin. Today's session is being recorded. We're going to hear from 30 students across 20 presentations, so buckle up. It's going to be a fun night. Lots of presentations and really cool projects to hear about. There is a full list of presentations that we can share with you if you want to see them after. And I'm just going to put that link in the chat. And then let me just move this here, sorry. And then in the interest of time, what we're going to do is move through all the presentations first and then reserve the last 10 minutes for audience questions. So if you do have kind of questions along the way, feel free to put them in the chat. But otherwise, we're going to get going. So we have lots of students. Some of them are in pairs, some of them are on their own, and we're going to kick it off with Meg Hayes, and she's going to tell us about her honors project.
Hello, my name is Meg Hayes, and for my summer honors research project, I had the opportunity to work on a study titled Adaptation of Arts-Based Digital Knowledge Translation Tools for Parents on Common Pediatric Health Conditions, comparing traditional and AI approaches, which was done under the supervision of Dr. Shannon Scott and the rest of the ECHO team. So this project focused on exploring the role of artificial intelligence, AI, in supporting the adaptation of parent knowledge translation tools, KT tools, for Canada's diverse linguistic communities. Over the summer, I translated an already existing bronchiolitis infographic into French, using both self-translation and AI methods. We used both large language model and phrase-to-phrase translators, such as ChatGPT, Google Translate, Reverso, and DeepL. We are now in the process of gathering feedback from French-speaking nursing students and French-speaking parents regarding the accuracy, relevance, and usability of the adapted tools. The results of this work will provide important insight into future KT tool development and ensure that health information is accessible, meaningful, and accurate to parents and healthcare professionals across Canada. Throughout this process, I gained valuable experience with the ethics application process. This is one of my favorite aspects that I learned throughout this project. I learned how to structure and prepare an application, as well as the many steps, details, and requirements involved in obtaining approval. I was also introduced to the process of an ethics amendment and how to change an already existing application to fit for an existing application to fit for a new project. This process gave me a better understanding about the complexities and the considerations that go into conducting ethical research. One of the aspects I enjoyed the most was learning more about AI and translation tools. I worked and met with the members of the ARCH team for discussions. Their team is also pursuing AI work. We were able to share experiences and gain insight about AI and our personal projects. With the help of the ARCH team and the ECHO team, I developed a new understanding of how AI and different translators work, as well as the differences between large language model translators and phrase-to-phrase translators. Large language model translators being ChatGPT and Claude, for example, and phrase-to-phrase translators, for an example, being Google Translate or Reverso. I also learned about the concept of feeding AI, which is the process of training an AI model by supplying it with data to improve its accuracy and its performance. For the future, I would like to expand my research skills by exploring different methods of data collection. In particular, I would like to gain more hands-on and in-person experience, such as conducting interviews, engaging directly with participants, and collaborating with new groups. I believe these opportunities will further strengthen my skills as a researcher and allow me to contribute meaningfully to future projects. Thank you.
Great. Thanks, Meg. That was awesome. I love hearing about doing those ethics applications. So good. Okay, next up we have Tori and Shanzi. And I'll just let Heather share her screen.
Hi everyone, I'm Shanzi and this is Tori, and we are second year BSCN after degree honors nursing student. We're supervised on this project by Dr. Colleen Norris and Nicole Tay, a PhD candidate. Our project focuses on heart failure, which is the second most common cause of hospitalization in North America. One of the biggest challenges is poor adherence to guideline-directed medical therapy. This is especially concerning for women who experience higher mortality and morbidity from cardiovascular disease. Women are also underrepresented in clinical trials, even though heart disease can present differently compared to males. We know that social determinants of health, such as financial, physical, mental, and social needs, are strongly linked to poor adherence, worse outcomes, and a reduced quality of life. To help address these barriers, social prescribing connects patients with community and non-clinical services through a link worker, providing psychosocial support to bridge the gap between medical and social care. This project is part of a multi-site randomized clinical trial, which means participants are randomly assigned to either a control or intervention group across multiple locations in Montreal and Edmonton. The intervention group includes a link worker who supports participants in managing the SDOH that were affecting their medication adherence and quality of life. The study is titled Social Prescribing to Improve Outcomes and Adherence to Congestive Heart Failure. The research question asks, can social prescribing through individualized referrals to community supports improve adherence and quality of life in Canadian women with heart failure who are at high risk for non-adherence? The primary objective is to determine if social prescribing can reduce hospitalizations and deaths in women with heart failure and improve adherence to pharmacological regimen. Tools like SPARK questionnaire is used to identify these women at higher risk of non-adherence, making it possible to deliver targeted interventions.
Next, we'll go over our research deliverables. We found resources and organizations for Edmonton and Alberta to guide the link workers' social prescribing. This was titled the Edmonton Community Resource Guide. This was similar to an environmental scan. We attended meetings throughout the preparatory phase to learn more about the preparation of a study before participant recruitment. We edited and reviewed documents in REDCap to prepare for data collection and will contribute to writing the introduction and methods for this study. We'll go over what we enjoyed and learned. We enjoyed collaborating with the Research Institute of McGill. It allowed us to explore differences in research between provinces. We liked finding resources that are available in our community. This will be beneficial in our nursing practice and future clinical placements. Lastly, we enjoyed observing how a study adapts and changes, and how challenges are navigated between different researchers and institutions. We learned about the complexity of research before a study can proceed. For instance, challenges associated with getting ethics approval and approval to hire the required personnel for the study. We learned about the challenges associated with working in a multi-site study, as different teams can be at different stages. And lastly, we learned about the ethics approval process and navigating site-specific software for U of A that was ARISE. Looking ahead, next to be explored in this study includes data collection and entry into REDCap. We hope to be part of analyzing and interpreting data. We want to know about the effectiveness of a link worker, how this service benefits patients, and the ability to incorporate this service into nursing. Lastly, we're excited to explore the process of collaboratively writing between different sites and provinces. Our outcomes is that we expect a co-authorship for an expected publication. We expect to have a deeper understanding of the research process from approval to interpreting data. And our last outcome is to be attentive to the effects of social determinants of health and how to include and address these aspects in nursing care. Thank you for your time. Here are our resources.
Excellent. Thanks so much, Tori and Shanzi. That was so good. Next up, we have Alexandra. Thanks for all the hands. That's nice. And Heather will share her screen.
All right.
No worries, Heather. I think if you hit preview, it'll go to full screen. Yeah, there you go.
Hi, I'm Alexandra Ramsey, and with the supervision of Dr. Holly Simmons Brown, my summer research focused on analyzing how military medical officers during the Second World War taught soldiers about battle neurosis. My research project formed part of a broader genealogical study that our team, which includes Dr. Melissa Stoops and Randy Ziorio Dunlop, is undertaking on the historical development of trauma and violence-informed care. Today, trauma and violence-informed care has become a solution across healthcare, education, and social services realms. Yet, there are still major gaps in how organizations implement it. By tracing the genealogy of concepts across different moments, such as focusing on 3 distinct periods that are World War II military psychiatry, the DSM-3 era of the 1980s, and the more recent SAMHSA guidelines, we can see how certain assumptions about trauma were established, reinforced, or silenced. My role this summer was to ground that genealogy in the World War II context. Regarding the methods I used a discursive approach to data extraction, focusing on the language, framing, and teaching strategies embedded in wartime sources. My primary evidence came from archives like Library and Archives Canada, Medical Services and Warfare Archives, and the Imperial War Museum. Using these databases, I examined medical officers' lectures, letters, training films, and pamphlets. Rather than simply catalog treatments, I looked closely at how psychiatric knowledge was constructed, communicated, and circulated within the military context of World War II. A key finding that I discovered this summer is that medical officers during World War II framed acute psychological reactions not only as an individual medical problem, but also as a potential threat to unit cohesion and mission success. They feared what they described as the contagion of symptoms, where one soldier's breakdown might destabilize morale across the group. Therefore, instruction extended to soldiers of all ranks, both commissioned and non-commissioned members, teaching them to identify early signs of stress reactions and intervene quickly. Central to these teachings was the PI method, which included proximity, immediacy, and expectancy. Officers emphasized treating soldiers as close to the front as possible, providing care without delay, and cultivating an expectation of recovery and return to duty. The educational materials also stressed keeping soldiers occupied with structure and menial tasks during recovery. At the same time, my research revealed that medical officers recognize the limitations of this framework, acknowledging that symptoms could persist or appear even outside of the direct battlefield stressors. This complexity points to early recognition that trauma was not purely situational. By analyzing these wartime discourses, my research demonstrates how psychiatric knowledge was mobilized through military pedagogy. Officers used these lectures, films, and pamphlets to translate medical concepts into tools for operational readiness. World War II military psychiatry bolsters and provides the first layer of our genealogical analysis. It shows how trauma was initially framed in relation to discipline, manpower, and morale, setting the stage for later redefinitions in the DSM-3 era and in the contemporary guidelines for trauma and violence-informed care.
Oh my gosh, what a cool project. I would love to work on that. Oh, thanks, Josiah, that's cool. Okay, next up we have, I want to say this right, Humna Khalid, and their project.
Hello, my name is Hamna, and I am a fourth-year nursing student in the honors program at the University of Alberta. My honors project was under the supervision of Dr. Ashley Hyde. I chose to pursue the honors program because I wanted to challenge myself beyond the traditional nursing curriculum. Throughout this process, I've been able to explore my interest in pediatric nursing while developing skills that will strengthen my future practice. For me, research represented an opportunity to step beyond my comfort zone. It challenged me to engage with unfamiliar perspectives and complex information that I wasn't used to doing before. I was also in this process able to learn how to interpret and analyze evidence at a greater depth. Simultaneously, it has been an important step in my professional development as it has supported my understanding of how evidence-based knowledge really does integrate into nursing practice daily. My project is a scoping review on digital health interventions to support the well-being of parents of children with medical complexity. These are parents who care for children with multiple chronic health issues and high care needs. They experience much higher rates of stress, anxiety, and depression compared to parents of healthy children, and that in turn affects their own health as well as their child's outcomes. What makes this work important is that access to traditional in-person mental health supports can be limited, whether it's due to distance or to stigma. Digital health interventions, such as apps or online programs, offer flexible, cost-effective, and accessible ways to help parents manage their well-being. By mapping the existing research, my study helps us understand what tools are out there, how they're designed, and how effective they really are. This is crucial for identifying gaps and building stronger, more impactful interventions in the future. Reflecting on this experience, I have grown not only in my knowledge of the topic, but also in my development as a researcher. I built important skills in literature screening, in data extraction, and synthesizing findings. I gained a clear understanding of how digital health interventions can support the well-being of parents caring for children with medical complexity. One of the aspects I appreciated most out of my honors project was being part of a research team. Seeing how collaboration and mentorship can really move a project forward showed me the true value of teamwork in research. Looking ahead, I hope this work contributes to development of digital interventions that are meaningful and practical for families living with complex medical needs. My goal is that studies like this help shape health system changes that put family-centered care at the forefront and improve outcomes for both parents and their children. This experience has shown me that research is more than academic pursuit, it's also a way to create change. I'm excited to carry out what I've learned in my future nursing practice and into research that continues to support families in meaningful ways. I'd like to thank my supervisor, Dr. Ashley Hyde, for her guidance and mentorship throughout this project. I also want to thank the Faculty of Nursing for providing me the opportunity to be part of this summer research program. Thank you so much for listening.
Great. Thank you, Hamna. That was so good. Okay, next we have Alicia and Laura.
Hello, everyone, and thank you for taking the time to watch our presentation today. Our project is an infographic informed by the scoping review titled Experiences of Indigenous Peoples Transitioning Through Hospital Settings in North America. Before we dive into the project, we'll each introduce ourselves. My name is Alicia, and I'm a second-year honors nursing student with a Master of Public Health and Master of Health Sciences.
And I'm Laura. I am also a second-year honors nursing student. I have a Bachelor of Science majoring in neuroscience and a certificate in Indigenous Studies.
Together, Laura and I are exploring the experiences of Indigenous peoples transitioning through hospital settings in North America through a Gray literature search and an infographic informed by the master's student work, Jose Jolie Scoping Review. We are working under the supervision of Dr. Caitlin Tate.
Before we begin, we would like to acknowledge that neither Alicia nor I are Indigenous. We are both settlers to this land we call Canada today. With that in mind, we want to respectfully recognize the peoples who have called this beautiful place home since time immemorial, and whose traditional territory we have the privilege of working, playing, and learning on today, including the Cree, Blackfoot, Métis, Stoney, Dene, Iroquois, and Ojibwe Saulteaux. The University of Alberta, its buildings, labs, and research stations are primarily located on these territories, which are part of Treaty 6, 7, and 8, and the homeland of the Métis. As non-Indigenous researchers, we approach this work with humility, recognizing that our role is to listen, learn, and amplify Indigenous voices rather than speak on their behalf. We are guided by the Truth and Reconciliation Commission's calls to action on health and education, and by the Tri-Council policy statement, which emphasizes respect, reciprocity, and community engagement in research with First Nations, Inuit, and Métis peoples.
So far in this project, we have been searching for Gray literature sources and extracting relevant data. Our next step will be to analyze this data and represent it in the format of an infographic with the guidance and support of the Indigenous Wellness Corps. Through this project, we have learned that searching for Gray literature is time-consuming and often requires digging really deep. It has been particularly challenging with this topic because there are so many Indigenous groups in Canada and the United States, and general search terms do not always yield the right results. We have realized how important it is to study the different nations' names and organizations in order to find meaningful sources. One of the most meaningful parts of this project has been learning from Indigenous people's experiences. These insights highlight the ongoing need to decolonize our health systems and structures, and that we still have a lot of work to do. We have also found it important to recognize the strengths and positive stories alongside the challenges.
Next, we'd like to explore how Indigenous-led approaches to transitional care can be supported and scaled within our healthcare systems. We'd also like to learn from how other countries, such as Australia and New Zealand, have developed Indigenous-led health transitions and what lessons Canada can take from them. Thank you for taking the time to listen to our presentation. We look forward to your feedback.
Thank you again.
Thank you, Alicia and Laura. That was excellent. Our next presentation is by Wania.
Hello, my name is Vanya Khan, and I'm entering my 4th year of nursing at the University of Alberta. This summer, I was part of the Undergraduate Nursing Honors Program, which gives students like me the opportunity to step into research and learn the process firsthand. For me, this meant not just reading studies, as I was used to doing in class, but actually participating in the careful and often complex work of creating research. I have always been curious about the bigger picture of healthcare, not only how care is delivered at the bedside, but also how knowledge is built, whose voices it represents, and how that shapes the kind of care people receive. The honors program gave me the chance to explore those questions more deeply while developing the skills to think critically about systems, evidence, and equity. I had the privilege of working on a project titled Scoping Review of Racial Cancer Disparities Reported in Canada under the supervision of Dr. Ana Santos Salas and Dr. Harkirat Judge. This project mattered to me because it highlighted how the questions we ask in research reflects the kind of care that becomes possible. Canada is often described as a diverse country, Yet that diversity is not reflected in cancer research. Because race-based data isn't collected in the Canadian Cancer Registry, the inequities that racialized populations face in screening, treatment, and outcomes often remain invisible. Engaging in this project gave me the chance to step into that gap and ask what Canadian research can tell us about these disparities, and equally, what it cannot. My role in this work was to explore the process of research itself. Alongside my colleague, I completed full text reviews, applied inclusion and exclusion criteria, and extracted key data. I also learned the practice of citation chaining, which felt almost like detective work, tracing references to uncover additional studies and expand the conversation. What I discovered through this process is that research is not just about gathering information, it is about making choices, deciding what is meaningful, what is credible, and how evidence connects. Research is slow, meticulous, and sometimes painstaking, but that is what gives it its strength. Most of all, I realized that research is about connections, linking studies to one another, linking evidence to practice, and linking myself as a student to a larger community of knowledge building. Before this summer, I only encountered scoping reviews as polished, finished articles. Now I understand the rigor and collaboration that go into producing them. That shift from being consumer research to being part of its creation has been transformative for me. So, what I enjoyed most was discovering the collaborative nature of research. On the surface, it can look like solitary work, but I experienced it as a dialogue with my supervisors, with my colleagues, and even with the literature itself. Each study brought its own perspective, but linking them together revealed broader insights and raised new questions. Looking ahead, I want to continue exploring how nurses can play a stronger role in research that addresses inequities. Later this year, I will have the opportunity to present this work at the Canadian Association of Nurses in Oncology conference in Banff. For me, that feels like the beginning of a larger journey, a chance to share what I've learned, to listen and to grow as both a nurse and as a researcher. This summer taught me that research is not only about producing evidence, but also about responsibility. The responsibility to notice what is missing, to question what is assumed, and to use knowledge in the service of equity. I am deeply grateful to my supervisors, my research team, and the Nursing Research Office for supporting me throughout this journey, and I look forward to carrying these lessons with me into the next chapter of my nursing career. Thank you.
Great. Thanks so much, Manya. All right, up next we have Helena and Pauline.
Hello everyone, welcome to our presentation for our honors project titled Gendered Ageism in Continuing Care, Impact on Older Persons Care. Our names are Helena and Pauline, and we are fourth year Bachelor of Science in Nursing honors students, supervised by Dr. Caitlin T. Our honors research project involved conducting an environmental scan to identify and assess governance systems that shape advanced practice nurses' roles in addressing health inequities in older adults. So, an overview of our environmental scan, we began with a search strategy that allowed us to gather studies from multiple databases. Then we conducted a screening process by starting with title and abstract screening and eventually screening the full text. After we determined our included articles, we developed an extraction form and extracted data from the full text studies. Finally, we did an analysis of our findings and data. Together, we learned how to carry out a systematic research process from developing a search strategy to conducting screening and data extraction. Working through the environmental scan taught us how to navigate academic databases efficiently and manage large volumes of literature. Beyond technical skills, a key learning I took away from this project is how policies influence the scope and impact of advanced practice nurses in caring for older adults. I saw how gaps in policy can limit access to equitable care, especially when the unique needs of older adults aren't fully considered. This helped me recognize the importance of policy in either reinforcing or reducing barriers and how APNs can play a key role in addressing these challenges in practice.
An important insight I gained from this project is just how much gendered ageism affects access to equitable healthcare. It creates real barriers for older adults, influencing the services they receive and often undermining their concerns. At the same time, this work showed me that these barriers aren't fixed. Advanced practice nurses, along with thoughtful policies and practices, have the power to help dismantle them and improve access to equitable healthcare. Next, we would like to explore how approaches that work well in one community could be adapted for use in under-resourced settings. For example, if a method of supporting older adults works in Canada, how could it be modified to meet the needs and resources of communities elsewhere? We are interested in understanding what makes these practices effective and how they can improve care for more people. We really enjoyed the aspect of collaborating on the entire process, being able to work together to develop our search strategy, discussing which studies were most relevant, and critically evaluating sources was very engaging. It was also satisfying to be able to see our efforts come together and understand how these pieces of information form a much bigger picture. Thank you for listening.
Perfect. Thanks so much, Helena and Pauline. Next, we have Michaela.
I may have to come back to this one.
Okay, no worries. Do you want to go to Rashant and Destiny?
Okay.
And we'll come back to Michaela.
Hi, my name is Destiny, and I'm a fourth-year honors nursing student. I'm passionate about Indigenous health, harm reduction, GI health, and palliative care.
And my name is Roshan Twig. I'm also a fourth-year honors nursing student, and I'm most passionate about Indigenous health, men's mental health, and those experiencing homelessness. Together, under the supervision of Dr. Sadie Deschaines and the Indigenous Wellness Corps, we researched Indigenous people's experiences in acute care through a mainstream media review. We examined how mainstream Canadian news outlets report the acute care experiences of Indigenous people. We wanted to see not only what was being said, but how it was being framed, whose voices were amplified, whose were missing, and whether systemic racism and colonial legacies were being acknowledged or not. By reviewing patterns across media coverage, we aim to better understand how public narratives shape awareness, policy conversation, and ultimately the healthcare experience for Indigenous people. In short, our work looks at the stories that get told, the ones that don't, and why that matters.
So through this project, we learned that research can be both meaningful as well as tedious. So many of our articles were emotionally taxing just because of the depiction of Indigenous individuals suffering due to systemic racism and health inequities. So this research really also required a lot of mindfulness and intentional self-care to maintain productivity. We also learned a lot about cultural humility as we were engaging with testimonials that are very different from our own lived experiences. Therefore, we needed a lot of self-reflection and time to ethically engage with the stories depicted within these articles.
What stood out to us the most was the collaborative process. While much of our time was spent in data extraction, the moments where our groups came together to reflect were incredibly powerful. We learned from stories that are rarely prioritized in academic spaces, and sharing those insights as a team kept the human element at the center of our work. We value the balance of independent analysis and deep group dialogue, which reminded us that behind every data point is a lived experience with real-world implications.
So conducting research under the umbrella of Indigenous health really reinforced our desire to explore Indigenous community-led research, specifically to support the integration of Indigenous knowledge systems into healthcare education. So we think that Western medicine has a lot to learn about healing, community, and culturally safe care. And we think that a lot of Indigenous-led research can really bridge that gap. As well as conducting a mainstream media review, we learned that not a lot of mainstream media reviews have been completed. Mainstream media is huge in disseminating knowledge and influencing culture. Therefore, we think it's really important to keep examining mainstream media.
And our topic matters because Indigenous people continue to experience preventable harm in healthcare, which is rooted in systemic racism. This isn't always overt, sometimes it's in the policies, or sometimes whose voices are being ignored. That subtlety makes it harder to confront, but is no less damaging. A major realization was how little mainstream media actually um, covers Indigenous healthcare experiences, and how few Indigenous-led solutions are highlighted, let alone being implemented. Moving forward, our work has to center Indigenous-led initiatives not as a token effort, but as a foundational to reimagining the healthcare system. This project has shaped our future research goals, which are to prioritize community leadership, embed principles of decolonization, and push for systemic change that truly serves the people it claims to care for. Thank you.
Thank you.
Excellent work, Rashant and Destiny. Heather, do you want to go to Michaela now?
I'll see whether it opens now.
Okay.
Yay.
Yay!
Hello, my name is Michaela Menkla, and my supervisor's name is Dr. Shannon McDonald. And this presentation is a report on summer studentship activities related to community engagement and knowledge translation in Indigenous health research. And so the project I worked on was the uptake of cancer prevention vaccines among First Nations youth, a First Nations Childhood Immunization Project, Finch, and it is located in Musqueam on Treaty 6, a First Nations community composed of 4 Cree Nations, the Ermineskin Cree Nations, Samson Cree Nations, Louisville Tribe, and Montana Nations. And for the activities for over the summer, I attended weekly meetings and learned about the Musqueam First Nations community. I also collaborated with creating a document for a First Nations Advisory Committee information sheet for the Finch project. And I also completed some training modules just to respect Indigenous people in research. And this included the Canadian Institute of Health Research, Sex and Gender and Primary Data Collection with Human Participants, National Sciences and Engineering Research Council of Canada, a guide on integrating equity, diversity, and inclusion considerations in research, an EDI framework, the Tri-Council policy statement regarding research involving First Nations, Inuit, and Métis people of Canada, OCAP, how First Nations data and information is protected using the ownership, control, access, and possession. And this is about Musqueam and my project. So I learned about what Indigenous research looks like outside of healthcare, outside of nursing, and understanding how that term relationality is used in Indigenous research. I have joined a relationality lab also to enhance just my own personal learning. And I was able to travel to the Musqueam community for a lands-based culture teaching and be able to connect with community and learn about the art of visiting with Indigenous people in community. And for my project, I created an annotated bibliography about how community engagement and knowledge translation can improve Indigenous health research. And so this learning really helped enhance my understanding of how the research process should respect Indigenous peoples to build trust for effective community engagement. And this is what I enjoyed and what I would like to learn about. So just visiting the Musqueam community is what I really enjoyed the most, being able to see where that research project is taking place and seeing who the project is supporting. And I really enjoyed just being able to tour the health center in Musqueam, their community, and just meeting the staff members at the Musqueam Health Center. They were very welcoming, encouraging, and helping me tour the facility. And Grant Bruno is a First Nations researcher who focuses on Indigenous youth with autism. And I actually read a few of his articles as part of my learning journey as well. And I was able to travel again to Musqueam, where they had an autism awareness gathering and a walk event. And I was able to hear speakers such as the Indigenous Maori people from New Zealand. And they also had a panel of speakers just sharing their experience with autism from that Indigenous perspective. And for me, I would like to learn about, for future research, would be to ask the question, Why do First Nations communities not have access to clean drinking water in 2025? Thank you. That is my presentation.
Excellent. Thanks so much, Michaela. And our next presentation is Ziyu Li.
Hi, so the topic of my summer research is taking care of fragile body, embodiment, and advanced cancer patients on board targeted agents. And this is a secondary analysis from the original longevity study. And my objectives are, so first I want to understand the embodied experience of cancer patients, how they live in and with their changing bodies. And second, I want to move beyond symptoms and explore the daily lived realities of those taking or targeted therapies. And this meant listening deeply to how they navigate routines, relationships shaped by cancer treatments. My analysis was guided by Arthur Frank's body problem framework, which helped me better understand how patients make sense of their bodies under treatment. Frank outlined 4 major tensions people may feel in their embodied experience of illness. These include a sense of control over the body, whether one feels connected or detached from it, how others factor into that experience, and the presence or absence of desire. These categories help me interpret patient stories not just as symptoms report, but as reflections of survival. So in terms of procedure, I first review 6 interview transcripts and create a narrative summary for each. Then I select the 3 participants who are May, Kevin, and Michelle for deeper analysis. Then I follow Brandt's thematic analysis and integrate both deductive coding using Frank's framework and interpretive reading. And so in terms of findings, our participants experienced the threat of body contingency due to their illness, and they all develop routines to help themselves regain body predictability. May, for example, she uses multiple tools like shoe horns, heating pads, and winter footwear to avoid pain and falls. Kevin creates a night routine before he goes to bed. And Michelle, she struggled with her treatment at first, but regained some level of control through routines, like making plans for her blood work, schedules, and tracking her symptoms. And all participants exhibit some level of detachment from their bodies, treating them as objects to manage. For example, May, she create routines helped her discipline and protect her from harm. And Kevin thinks his soft nails are something inconvenient, but it's manageable. Michelle, for example, she covered up visible signs with makeup, and she says that she eats because she has to. And each participant has different ideas on how much of their illness can be shared. May, for example, actively engage in community activity, and Kevin, he doesn't tell his coworkers about his illness, and he doesn't share a lot with his sons and his family members about the illness. Michelle, she provides care to her grandkid and desire peer support. So the last one that I analysis is about desire, and all participants appear to have fluctuating desire. May, for example, she focuses on her community involvement, trying to distance herself from physical decline. Kevin, on the other hand, is cautiously hopeful, wants to maintain normalcy, still works full time, and engages in research to want to contribute. Michelle, she doesn't want to continue her treatment at first, but then she persisted by finding meaning in caring for her grandkids. and she thinks a support community can help others like. So these stories show us that taking targeted therapy isn't just about taking pills, it's about adapting to a body that has changed. Something suddenly, sometimes it can be very slowly. Using Frank's lens allow me to explore how people care for bodies that feel fragile but not defeated, where vulnerability and resilience live side by side in each narrative. And that's it. Thank you so much.
Excellent. Thanks so much, Ziyu. So just to let you guys know, we're now at the halfway point. And just to remind you, if you have questions for the students at this point, please feel free to put them in the chat and then we can answer them toward the end. So we're going to keep going. We still have up to 20 presentations, so we're getting there. We're on number 11 now. So our next pair is Sane and Josiah.
And we're both fourth-year honors nursing students working under the supervision of Dr. Papa Sana Silvo and Shaista Megami. Under our supervisor's broader project titled Non-Pharmacological Soundscape Interventions for Patients Recovering After ICU Hospitalization, it explores how combinations of sounds can help ease symptoms such as anxiety, sleep disturbances, and cognitive stress in patients after they've been in an ICU. Studies like these are especially important because ICU survivors often face long-term physical and psychological effects that current approaches don't fully address. While involving post-ICU patients in research is a crucial first step to understand their needs, it also is the most challenging, precisely because this is such an under-researched area. With limited guidance available, there are still many unanswered questions about how to ensure meaningful, ethical, and high-quality engagement with this demographic. In order to explore these issues, we were assigned a subtopic called Post-ICU Patient Engagement, Challenges, and Engagement Strategies. While researching this topic, we discovered that researchers working with this population often encounter barriers that make the recruitment and engagement process more complex. These challenges inspired our literature review, which aims to identify both the obstacles and the most effective strategies for involving post-ICU patients in research. Our journey so far has included screening and analyzing current literature, creating a working abstract, and presenting our preliminary findings at both the Nursing Alumni Tea event and the Innovate Conference, where we were honored and excited to receive the Undergraduate Poster Award. Beyond the academic side, this experience has deepened our understanding of what high-quality, ethical research looks like. We've learned how much thought and care goes into building on previous studies, ensuring validity, and contributing meaningfully to the evidence base. We've also appreciated the chance to connect with experienced researchers and peers through the studentship series. Having these conversations and hearing other perspectives will help us be better nurses in the future that are aware of the impact of research that can have on clinical practice. As we progress through the year, we are eager to continue working closely with our supervisors to further develop and publish our literature review. We're genuinely passionate about research and committed to contributing meaningful work to the healthcare field. By publishing our findings, we hope to provide valuable insights that can support other researchers in designing their own studies. Looking ahead, we are excited to pursue further research. For instance, we are interested in investigating topics in critical care, pediatric care, reproductive, and women's health. We hope continued efforts will help inform evidence-based practices in care environments. Overall, this experience has been incredibly rewarding, and we're excited to keep building our skills and contributing to an area of care that truly matters.
Lovely. Thanks so much, both of you. Our next presentation is another pairing, Zara and Medea.
Hi everyone, my name is Eleanor.
And I'm Zara. We're both fourth-year nursing students at the University of Alberta in the Collaborative Honors Program.
Today we'll be presenting our experiences from our honors research project and I'll highlight our key learnings.
Our project focuses on the health practitioner regulation, something that is important for keeping the public safe. It makes sure health professionals, like doctors and nurses, are doing their jobs properly and safely. Regulation also helps improve the healthcare system overall by making services more accessible, supporting healthcare workers, and keeping the system strong.
However, even though the goals of regulation are clear, it's hard to know how well these goals are actually being met. That's why measuring and evaluating how regulators are doing is so important, especially now, when people, governments, and healthcare workers are starting to question whether regulators are doing a good job. Some regulators do check their performances, but we don't really know how similar or different their approaches are.
The aim of this review was to examine the nature, extent, and range of literature focused on performance measurement and evaluation of health practitioner regulators. It explores existing frameworks, including the principles, focus areas, and metrics or indicators described in the academic and grade literature.
A key learning that we received, particularly when completing the full text screening, was learning to apply a more nuanced and detailed application of the inclusion and exclusion criteria. We quickly discovered that disparity between abstract and full text screening, the latter often revealing complexities not always apparent in the abstracts exclusively. Examples include studies partially meeting the criteria or discussing multiple concepts from which we had to distinguish between what is applied conceptually versus contextually.
Working in a large research group also showed us how important it is to stay in regular communication and check in with each other, especially when deciding on tricky or unclear studies. Talking through these together helped us stay on the same page and make more consistent decisions. We also learned that having team members with different backgrounds and experiences brought up helpful insights. People noticed different things or interpreted information in unique ways, which improved the quality of our screening and decision making.
As health practitioner regulation is such an underrepresented area of research, we really enjoyed learning more about the intricacies of health regulatory systems, including how performance is defined, measured, and interpreted across different jurisdictions and professional contexts.
In future research, we would like to examine how regulated professionals and members of the public perceive the effectiveness and accountability of health practitioner regulators to better understand how these perceptions influence trust, compliance, and engagement with the regulatory system.
We'd like to thank our supervisor, Dr. Patrick Chu, his team, and the faculty for all the support and guidance.
Thank you for listening to our presentation.
Awesome. Thank you, Zara and Medea. That was excellent. Okay, the next group is Avery and Emma.
Good afternoon, everyone. Welcome to our presentation on our summer studentship, where we will discuss our honors project, other learning activities, and what we learned. We are Emma Hebel and Avery Olafson, fourth-year collaborative Bachelor's of Science of Nursing students. Over the past year, we've had the pleasure of working under the supervision of Dr. Norris, focusing on relevant topics in women's cardiovascular health. This focus was the basis of our honors project, which is titled Mapping the Current Use of Nurse Practitioners in Women's Cardiovascular Care. As we enter our final year of nursing school, we've applied for preceptorships in both women's health and cardiovascular care, aligning our clinical placements with our passions and enabling us to continue this work as future registered nurses. Outside of school, I work as a UNE on the medicine flow team at the Royal Alexandra Hospital. I also enjoy running and spending time with my rescue dog, Louie. Elle works at a garden center and spends her spare time gardening and hiking the trails with her dog, Lola. Alrighty, so we're going to go a little more in depth on our summer project here, again, which was the mapping the current use of nurse practitioners in women's cardiovascular care. So a little bit of background here. Cardiovascular disease is the leading cause of mortality for women worldwide, yet care for women remains inadequate. Awareness is lacking not only among women themselves, but also among healthcare providers, due in part to the historic underrepresentation of women in research. As a result, many clinical guidelines are based almost exclusively on data from male populations, leading to a one-size-fits-all approach that fails to address the unique risks and presentations in women, leading to overall poor health outcomes. Through a gender transformative approach, our project aims to address these gaps by promoting care that is equitable, accessible, comprehensive, and tailored. So what we did, we conducted an environmental scan
using existing databases to explore the use of women's heart clinics and the role of nurse practitioners within these settings. We analyzed additional factors affecting care accessibility and quality, including referral requirements, available services, and delivery methods. We also performed a literature review to understand how women's heart centers bridge existing care gaps and address systematic inequities. Our search was further refined to investigate NP-led pilot programs aiming to implement novel approaches to care. Lastly, we began synthesizing our findings into a manuscript, which we aim to submit to publication this fall. Thank you.
Supplemental to our primary project, we're also trained as research assistants on another study that was examining arterial stiffness in perimenopausal women. We assisted with collecting anthropomorphic data, conducting standardized blood pressure measurements, and performing pulse wave analysis and pulse wave velocity testing, as you can see an example on the right of the slide. In each of these sessions, we also provided participant education based on those individual results and on the role of estrogen in cardiovascular health overall. We also completed ethics training to gain a deeper understanding of the research process as a whole. This experience has been incredibly rewarding for both Avery and I. We've come to realize over the summer that improving standards of care for women has to start with research. Research that informs guidelines, clinical approaches, and policy. And throughout our project, recurring themes have gone far beyond what first meets the eye. We explored not only the pathophysiology of cardiovascular disease and its hormonal influences, but also the broader and often overlooked psychosocial factors like health equity, accessibility, upstream prevention, intersectionality, systemic barriers, bias, and the lived experiences of women. This synthesis of biomedical and psychosocial dimensions truly reflects the essence of nursing research, contextualizing findings to develop tailored and meaningful solutions in care delivery.
Okay, great. Thanks so much. Sorry, that kind of ended abruptly. Okay, so our next presentation is split into two parts. So I believe we're going to be hearing from Taylor Hume first, and then Nicole Johnson.
Hi everyone, today I'll be presenting on my summer research project that studied resilience in long-term care managers. My name is Taylor Hume. I'm currently entering my final year in the after degree Honors Bachelor of Nursing program at the University of Alberta. Prior to this, I completed my degree in the Honors Bachelor of Health Sciences program at the University of Ottawa. I have been working with the TRIC research team under the supervision of Dr. Carol Estabrooks. I'm also grateful to have worked with Doctors Tatiana Penkonik, Heather Titley, and Joel Minion. The study I've been involved in is titled Supporting Resilient Managers in Healthier Environments for Care Staff Working in Long-Term Care. Within TRIC, we refer to this as the Manager Project. This is an ongoing study examining how participation in a leadership development program can improve knowledge and skills related to stress management, communication and leadership skills, peer support, self-care practices, and enhance resilience. TREC knows from its other research that long-term care managers are under significant pressure, especially following the COVID-19 pandemic. Prevalence of staff burnout has increased, and manager retention is a real challenge for continuing care homes. The Manager Project, funded by Alberta Health, is intended to support managers in developing socially intelligent leadership and communication skills, as well as self-care practices and resilience. Within the Manager Project, I have chosen to focus my project around the use of integrated knowledge translation to address burnout among long-term care managers. Integrated Knowledge Translation, or IKT, is a collaborative research approach that involves researchers working alongside research users in all parts of the research process to improve the implementation and success of interventions. The purpose of my study is to determine how IKT can be used to develop leadership interventions to address burnout in long-term care managers, effectively improving staff well-being and thus improving job satisfaction. Due to the timeline of this study, I used pre-intervention data collected from the Manager Project participants. Throughout this summer, I have attended project meetings as well as the Launchpad to Research Summer Series. The large portion of my work was focused on a rapid review that we have been completing for the Manager Project. My contributions included thorough abstract and full text screening. Once this process was complete, I completed the data extraction. This involved thoroughly reading the included studies and extracting all relevant data. I also completed quality appraisals for each study. Additionally, I have contributed to the manuscript for this project by assisting with planning and organization, writing some sections, and creating tables. Lastly, I continued to work on my honors project throughout this summer. I've really enjoyed the opportunity to work with the fantastic team at Trek. They have taught me a lot about the ins and outs of research while also offering insightful suggestions to my honors work. I have also enjoyed studying healthcare from a different lens. Nursing long-term care managers are not a population I've learned about before, and I'd be interested in pursuing further research into this population. Additionally, I am interested in pursuing a career in nursing management. As such, the findings from this research will help guide me in my future career. And finally, as a future nurse, it's extremely important to recognize the importance of nursing managers. To conclude, nursing managers are an incredibly unique and important population as their well-being impacts the entire care team. Managers are at the core of every nursing team, yet they remain a largely understudied population in research. While this research is important and relevant to the entire population, it is particularly important for us as nursing students to learn about the importance of nursing managers and promoting well-being before we enter our careers. Thank you for listening and have a great day.
Perfect. Thanks so much, Taylor. So I think our next one now will be the other half with Nicole Johnson.
Hello, my name is Nicole Johnson, and I am an after-degree honors nursing student working with the Translating Research and Elder Care team, also known as TREC. This presentation recaps the project on the barriers and facilitators of practicing coherent breathing among continuing care managers. So TREC's mission is to improve the quality of care and the quality of life for people living in continuing care homes, as well as the quality of work with staff. My honors project involved working on a process evaluation of an intervention to implement coherent breathing among continuing care managers. A process evaluation is a research tool used to help explain how and why interventions work or fail, and whether they can be transferred to other settings and populations. So why are we focusing on continuing care managers? Well, managers, who are often registered nurses, play a crucial role in ensuring the quality of care of residents in continuing care homes. However, high levels of mental, emotional, and physical strain, especially during the pandemic, have contributed to an increased risk of manager burnout. Any significant decrease in the retention of experienced managers has the potential to negatively impact the quality of care residents receive. So what was the intervention? Well, it was a program to advance leadership and communication skills with a cohort of continuing care managers through a series of coaching sessions. We also asked them to practice coherent breathing for 5 weeks. Coherent breathing is a simple technique in which individuals breathe in through their nose, deep to their belly for a count of 4, 5, or 6, and then similarly exhale without a pause between. And this technique has been found to help regulate the nervous system, slow the heart rate, lower blood pressure, and increase sense of calm. And you can check it out using the TREC and Healthcare Excellence Canada's online toolkit. So the process evaluation examined managers' experiences implementing this coherent breathing practice over 5 weeks. And my role was to help identify any barriers that facilitators encountered in translating this technique into everyday practice in continuing care homes. So to do this, I analyzed focus group transcripts and reading diaries looking for barriers to facilitators. And now I can show you some of my preliminary results. So here we can see how participants' breathing increased over the 5-week intervention. We asked them to start with 3 minutes per day in week 1 and gradually get to 8 minutes by week 5. On the x-axis, we have the week of coherent breathing, and on the y-axis, we have the self-reported minutes of coherent breathing practiced. So participants reported their practice every day for 5 weeks, meaning that each week is the average amount of minutes practiced by all participants. And as you can see, the average amount of minutes of coherent breathing practiced increased every week. Now we can look at the barriers and facilitators. So the barriers identified included time to complete the coherent breathing, a noisy environment, and interrupted workspace. And facilitators included feeling that coherent breathing was useful before, during, and after stressful situations. It allowed time to practice mindfulness, and it was easy to incorporate into existing practices. These various facilitators help point out how to best deliver information about coherent breathing during the program and how to ensure that the intervention is sufficiently practical so as to be implemented on a daily basis. So during my time on this project, I have learned to appreciate the practicality of qualitative research and to hear about participants' subjective feelings about intervention. Sitting in on focus groups and reading diaries to get a sense of their perspective of the intervention revealed a richness and depth of research that I haven't seen before. Thank you for listening.
Great. Thanks so much, Nicole. That was excellent. Okay, next up we have Jasmine Burke.
Hello everyone, my name is Jasmine Burke and I'm a fourth year honors nursing student at the University of Alberta. My supervisor for this research project was Dr. AWNR. The title of my research project is Coping with Trauma and Grief, Understanding Reproductive Health Behaviors of Displaced Mothers in Africa. At a personal level, I'm very passionate about women's health equity, and my background as a racialized first-generation immigrant has shaped much of my advocacy and research work, including this one. So a little bit about my project. Well, this research explores how conflict, forced displacement, and trauma influence women's decisions about fertility and reproductive health. I conducted a secondary analysis of interviews with 29 displaced women and 10 service providers and policymakers from a previous study. We looked not only at the practical barriers that these women face, like lack of transportation, limited services, availability, and cost, but also the emotional barriers, such as grief and trauma, which are often overlooked in reproductive health policy and planning. So why does this matter? Displaced mothers in Africa often face extreme challenges accessing family planning, pregnancy care, and maternal health services. These challenges aren't just logistical, they're deeply emotional. Grief from losing family members, homes, and community connections shape their reproductive decisions, yet these realities are rarely reflected in health policy. By understanding and amplifying these experiences, we can help design policies that reduce maternal and infant mortality, prevent unplanned pregnancies, and create services that are culturally safe and trauma-informed. My why. For me, this research is personal. As a racialized first-generation immigrant, I've experienced what it's like to navigate places that weren't designed for people like me. Growing up, I saw women in my community face stigma, resource limitations, and systemic barriers that forced them to put their health last. Through my leadership and advocacy work in Edmonton, I've learned that while bedside care can be transformative, it's not enough. Real lasting change requires research that informs policy, and that's why this project matters so much to me. One of the most surprising parts of this project was how the deeper I went, the more questions emerged. I realized that research isn't a straight path to answers. It's an ongoing conversation that sparks new ideas and reveals perspectives that you wouldn't have considered before. It showed me that curiosity is one of the greatest tools as advocates, because the more we keep asking, the closer we come to understanding and creating real change. The first time I read through these interviews, it was a deeply moving experience. The stories were not just data. They were raw, personal accounts of loss, resilience, and survival. Some were shocking in their details. Others touched me in ways that felt incredibly personal, reminding me of the strength women show even in the harshest circumstances. It was a powerful reminder that behind every statistic is a human life, and that our work as researchers carries a responsibility to honor those voices with care and integrity. In closing, I believe that real change begins when we not only listen to displaced women, but honor their stories as expertise in their own right. Their voices carry the truths that data alone cannot capture, and those truths must guide how we design reproductive and mental health services. This project is one step towards a healthcare system rooted in dignity, cultural understanding, and equity, a system where every woman's needs are seen and met, no matter her circumstances. Thank you.
Thanks so much, Jasmine. Okay, our next pair are Lauren and Jonathan.
Hi everyone, my name is Lauren and my partner's name is Jonathan, and we are currently wrapping up our project titled Identifying Mental Health Resources for Canadians Receiving Dialysis.
and environmental scan. So just to give a bit more information on both of us, I joined honors to broaden my positive impacts on patients, and I am very passionate about improving quality of life for those with chronic illness.
And I joined honors to advance the health and well-being of patients through research. And I'm also dedicated to working with patient partners to inform policy and practice. So dialysis is required for patients who have kidney impairment and their kidneys are no longer able to filter their blood. They either do dialysis in the hospital, where they have to go multiple times a week, or do home dialysis. People receiving dialysis commonly report increased mental health concerns, psychological distress, and decreased quality of life compared to the general population. However, they frequently do not know where to find freely accessible supports. Kidney care providers also do not know what resources to share with these patients.
So our project was to update the previously created resource list of freely available mental health supports for individuals receiving dialysis in Canada. These resource lists were originally developed through environmental scans, which were conducted by the honor students before us in December 2023. So to build on their work, we conducted a detailed review of each scan to identify broken links or outdated resources. And then we also performed a follow-up environmental scan to find and incorporate any new resources that have been published since December 2023.
So for our results, we identified an average of 17 broken links for each province, and an average of 6 of these cannot be found as the resource no longer exists. Included in these numbers were resources that no longer fit the inclusion criteria, such as resources that are now behind the paywall. Through our update, we found an average of 7 new provincial resources for each province and 5 new resources that were found to be available to Canadians nationally. This finding underscores the need for persistent updating and monitoring of these lists to ensure accuracy.
So the biggest lesson that we took out of this project was the importance of considering the population that you are working with. So throughout our time, we consulted with a community advisory committee, which consisted of patient partners who had a lived experience of dialysis. This allowed us to reflect on who we were really doing the work for and how we could make these lists and conduct the research to enable it to have the biggest impact for the people who are most deeply impacted, namely Canadians receiving dialysis and living with mental health concerns. So this is the end of our presentation. Thank you so much for listening.
Excellent. Thanks so much, Lauren and Jonathan. Our next presenter is Bharath.
Hi everyone, my name is Bharath and I'm an honors nursing student. I work under Dr. Shannon McDonald, who is a professor of nursing and adjunct professor in public health. She is a Tier 2 Canada Research Chair in Applied Pediatric Immunization, and her research focuses on supporting immunization best practice and policy. My topic explores the impact of COVID-19 on childhood vaccination rates here in Alberta. My contributions went towards helping make certain components of this report, which is primarily intended for policy advisors, program administrators, and clinicians. As we know, childhood vaccinations are essential to safeguarding public health, as they prevent infectious diseases, reduce mortality, and promote herd immunity. When COVID-19 was declared a pandemic back in 2020, I think we can all agree that it brought challenges and disruptions, especially to healthcare services. These interruptions led to significant declines in vaccination coverage, raising concerns about potential resurgence of vaccine-preventable diseases. If you've been following the news, you would likely have heard about the resurgence of measles here in Alberta. Yes, it is a scary ordeal, therefore making this topic one of great relevance. For this topic, some of my research activities included team collaboration, where I had the opportunity to work closely with fellow researchers and supervisors, sharing ideas, discussing findings, and incorporating feedback to strengthen the quality and focus of our project. I've reviewed literature such as academic studies and government reports to better understand factors affecting vaccine uptake during the pandemic, as well as catch-up strategies used to help improve coverage post-pandemic. I learned to interpret data to develop appendix tables and guide in helping with visual data representations such as graphs. I will now discuss some of my end products or deliverables. Given the nature of my work, knowledge translation was a significant portion of my learning experience. I gained an understanding of what knowledge translation is and its importance in communicating research findings to different audiences, such as policymakers and healthcare professionals. I summarized literature and shared key findings with the team on knowledge translation strategies to help shape the report's presentation. I gained foundational knowledge of different statistical methods, their significance in analyzing and interpreting research data, as well as understanding different types of graphs. I applied knowledge translation strategies to adapt the conceptual model based on the World Health Organization's behavioral and social drivers framework for vaccine uptake. This involved reviewing relevant literature to modify the model in a way that reflected pandemic-related shifts in factors such as sociocultural influence, knowledge perception, motivation, and practical issues. I contributed to creating appendix tables where I learned to organize data logically, perform accuracy checks and consistency checks, and ensure clarity for readers accessing supplementary materials. Throughout this project, I improved my reference management skills by learning how to use Zotero, which allowed me to efficiently collect, organize, and cite sources for the report. Something I really enjoyed working with was different team members up in the office and learning from their diverse perspectives, experiences, and areas of expertise. It was really rewarding to bounce ideas off of each other because the recommendations were often very insightful and helped me strengthen my critical thinking skills, which in turn helped me gain a deeper understanding of my topic. And that concludes my presentation. Thank you so much for listening.
Excellent work. Thanks so much, Barath. Our next pair is Chelsea and Anita.
My name is Anita, and I'm a third-year nursing student at the University of Alberta with a strong interest in dementia care and research. I volunteer with people living with dementia, where I've learned how meaningful connection and support can be in their daily lives. These experiences have shaped my passion for working with this population and has deepened my curiosity about how care can then be improved for them.
Hi everyone, my name is Chelsea Okafor and I'm a fourth year honors nursing student at the University of Alberta. My main interests are in health equity and dementia care. I also serve as the Vice President of Finance at the Canadian Black Nursing Alliance University of Alberta chapter, which has been meaningful to me because it allows me to advocate and support for my community within the nursing world. I'm also passionate about creating a more inclusive and supportive healthcare environment.
Our project, supervised by Dr. Hannah Arouk, examines what usual care means in the context of visitation for people living with dementia in long-term care homes. Currently, there's no unified definition of visitation practices, and these can vary widely across homes, staff, and family perspectives. Through a literature review and qualitative data collection using focus groups and surveys, we aim to describe how visitation is typically practiced and understood. This work will provide the much-needed clarity about usual care and contribute to future research on improving visitation experiences for residents, families, and care providers.
So through this project, we learned that usual care in visitation is not consistently defined or described in any of the literature that we were reviewing. While families are central to the lives of people who are living with dementia, there is very little agreement on what counts as usual or standard visitation practices. This highlighted for us the importance of capturing everyday care practices in a more systematic way.
What we enjoyed most was reviewing and synthesizing the literature to identify key patterns and gaps. It was rewarding to see how our analysis highlighted the essential role of families, the impact of visitation restrictions, and the inequities that exist in current practices today.
So in future research, we would like to explore how visitation practices directly affect the residents' quality of life and the family's well-being, and how policies could better support more equitable and consistent approaches to visitation across care homes.
Thank you for listening to our presentation.
Excellent. Thanks so much, Chelsea and Anita. That was awesome. Okay, our last presentation, but certainly not least, is Madison.
Hello, my name is Madison Gaudette, and my honors research supervisor is Hannah O'Rourke. So my research project is titled Boosting the Use of a Psychoeducational Care Support Intervention, My Tools for Care in Care. So My Tools for Care in Care is a web-based, self-administered psychoeducational resource designed for carers of persons living with dementia who currently reside in a long-term care facility. So I'm going to show you a brief overview of the website itself. So this toolkit is free to use for anybody who has internet access in an electronic device. So it is divided into 4 main sessions. So we have About Me, Common Changes to Expect, Frequently Asked Questions, and Resources. So the aim of this tool is to reduce care grief and to promote the carer's hope, self-efficacy, and quality of life while their loved one resides in a long-term care facility. My research activities will inform Dr. O'Rourke's next steps for this intervention, which includes a mixed methods study that evaluates the use of the intervention by diverse groups of Canadian carers. For my summer research project, I conducted a literature search on recruitment strategies aimed at increasing the diversity of participant sampling pools in dementia research. So once I completed this literature search, I synthesized my findings from the search, and I created a comprehensive report summarizing and evaluating the validity of the various recruitment strategies identified from the literature. And then I discussed their applicability to Hannah's research endeavors related to my tools for care and care. So overall, I noticed a trend toward community-based initiatives with a strong emphasis on community engagement outreach. There was also a push to diversify the recruitment team and modify materials for participants to ensure that they are culturally adapted and translated to the participants' primary language. So I also identified critical gaps in the literature. Most notably, there was a lack of consideration in the research for indigeneity, rurality, and low socioeconomic status. There were also major methodological limitations across the literature, and this pointed to a need to establish a more unified, rigorous approach to the research within this research community. In addition to the search, I was also given the opportunity to participate in one of Hannah's other research projects, Music Connects Us. So this is a music-based complex intervention that aims to facilitate social connectedness and improve the quality of life of long-term care residents living with dementia. So I learned about interventional design and evaluation methodology, abstract writing, and the processes behind conducting a literature search. I enjoyed learning about interventional research as well as reading and critiquing literature using a critical lens. As an Indigenous person, I would like to explore opportunities
to firstly determine if there's a place for interventional research in Indigenous communities. I'm really not sure what this would look like, but what I know is that I would like to work alongside Indigenous peoples who understand what, if anything, this westernized lens can bring and what I can learn in partnership with community. Thank you for listening.
Great. Thanks so much, Madison. And thank you all for those fantastic presentations. They were all so excellent. I love seeing the breadth of the work that all the students are doing. This is so good. So we now have a few minutes for questions. So please feel free to raise your hand, either your real hand or your virtual. And you can also put your questions in the chat. And I do see that a couple of questions were put in there already and answered. But Kara and Hannah, just let me know if you need any follow-up, and then we can do that now.
Lindsay, before we start, I have to say I am just so impressed with this. It was just the breadth and the depth and the excitement about it. And I think we need to get this out to the rest of the world to show how creative nursing research really is. And to see your enthusiasm. I'm just so impressed and so grateful that you all decided to take on summer studentships. And I want to say thank you from the Faculty of Nursing, because you make us excited about what we're doing and how we're doing it. And for sure, this recording is going to be used. I've written down a number of places where it's going to go to start demonstrating the breadth and depth of the work that you guys are doing. So thank you, thank you, thank you.
Thanks, Josiah. Oh yeah, Hannah, please.
Sorry, I couldn't find my microphone. I'm just wondering, from anybody who might like to respond, whether there was anything that surprised you about your experience in the research that you were involved in, something that surprised you or that you kind of weren't expecting, or yeah.
I can, Roshan, do you want, you can go.
Yeah, Roshant and then Lauren.
Oh, I was okay if Lauren wanted to go. But I'll go. I think one thing that surprised me the most was like, like the starting of research, like getting that framework started, like having that framework set up, and then it was such a back and forth with like does this work, does this not work? Like honestly, like when I went into research, I knew that there must be something that like we would have to do, but for it to take a year, like in our whole third year, to just like finalize the details, get kind of like collaborate with everyone, like the librarian, and like getting that input and seeing what we can work on throughout the summer. I think like the time commit like the time that it took to get to what we wanted to do. I did not expect that in the beginning, but I think that made me love research more, because I was like, there's like, it's so planned out and so detailed that I was like, I like it. And then there was some things I didn't expect while doing the research, which was like, I'm like, even though so much effort was put into this, I didn't imagine I would see this or I would encounter this. So yeah.
Very cool. Go ahead, Lauren.
Yeah, I agree with Roshan 100%. I feel like there was so many steps to, like, first off, just agree with him. There was so many steps in planning and like so many things that went into it. That was like a lot. I think for me, like what surprised me a lot was my project was more focused on like the patients themselves and like creating things that the patients will actually be able to use. And I found that very rewarding because, like, I think when I thought of research before I went into this experience, you very much think of very like rigorous, like systematic reviews and all of those things. So I found it very rewarding to be able, like, not that systematic reviews aren't rewarding or any, I'm not trying to talk down to anybody, but I realize that might have not sounded the best. I can see my guys are laughing at me. But like I think that was like a very interesting part of it, and like I think it like kind of showed all the different lenses of research and like how there's like very much so a place for all of them. And like I think in this conference especially too, seeing like all the breadth of what everyone's been doing and like seeing that there's a place for all of it and all of it will benefit patients and providers and everyone. And I just think it's so beautiful and amazing. So grateful to be a part of it. Yeah.
I agree, Lauren. Well said. Avery.
Hi, yes. Thank you, Lauren. Those were some really great points. And just like building off of that, I really appreciate like the policy and practice implications all of our research has. Like I truly believe research is where it all starts. And like for mine and Emma's project, we started looking at like accessibility barriers for women with cardiovascular issues, and we realized like with publishing our paper and everything, like this is how like change is going to happen. And I'm just so grateful to see everyone else's project, and it just makes me think of like all the positive change like all of us will affect. So yeah.
And Michaela.
Oh wow, why am I so nervous all of a sudden? I guess biggest thing for me, I think first day, I just realized there's a lot of sitting and a lot of revision, and it's actually very mentally draining. And I've never had that kind of thing before, if where it feels like the 9 to 5, but your mind's constantly going. And I've never read so much in my entire life, but that's okay. And then I think what I enjoyed, or what was surprised with, was in the honors program, there's not a lot of like Indigenous nursing students. And so I just want to say like thank you, Hannah. Like without Hannah reaching out to me and asking me to join the program, I wouldn't be here. And I think I'm really glad I joined the program, and thank you, Hannah, because you really helped me believe that I could be smart and I could do the honors program. And now my goal is just to inspire that next generation for, more Indigenous nursing students to join the honors program.
Yay. That's fantastic, Michaela. Anyone else or any other questions? Okay, well, I'm just going to say thank you all so much. Thank you for our presenters. Thank you for everyone for joining. The session has been recorded. I hope it's still recording. It is. And please visit our website to see recordings and announcements. I think we have a new website now. Is that right? I'm just going to put this in the chat. I'm out of the loop, everybody. Our next session of Alberta-wide nursing rounds will be on October 21st at 7 p.m. We will meet our new assistant professors in the Faculty of Nursing and hear about their incredible research and that will impact nursing practice. So I'm just going to put the registration link in the chat, and go ahead and all of you register, including the students, because we would love to have you there.
And go tell all your friends about it.
Yeah.
Anybody who's involved in nursing at all. We want to really open it up.
Yeah. We love to see lots of faces and to talk about research. It's so fun. Thank you, everyone. And if you have any questions or follow-up, please feel free to email us. Okay.
Thank you so much. Well done.
Thank you.